Good evening, everybody. I'm Fatima Sara Awos, and I'm going to talk about the antibiotic susceptibility patterns of Staphylococcus aureus isolates at a tertiary care hospital. Staphylococcus aureus, it's a gram-positive bacteria. It's also a facultative anaerobic bacteria. It's also a non-spore-forming bacteria. It's the causative agent for Staphylococcus aureus is the skin, soft tissue, and bone infections. And the major cause for Staphylococcus aureus is hospital-acquired infections and the emergence of multiple resistance to anti-staphylococcal agents has made the eradication of these bacteria difficult. Moving to the virulence factors, Staphylococcus aureus has many virulence factors. For example, capsular polysaccharide, membrane-damaging toxins, superantigens, protein A, enzymes, and so on. The mode of developing resistance in Staphylococcus aureus, it's the alteration of antibiotic binding targets, sites. Moving to MRSA, methicillin-resistant Staphylococcus aureus. It was first developed resistance to methicillin and subsequently to almost all beta-lactam antibiotics, and it was also first discovered as a hospital-acquired pathogen. This is a serious healthcare condition. Vancomycin is the drug of choice for invasive MRSA infections. There are two types of MRSA infections. One is the hospital-acquired MRSA and the other one is community-acquired MRSA. Certain risk factors for community-acquired MRSA or CA-MRSA are crowding, contact, compromised skin, lack of cleanliness, and contaminated items. Whereas for hospital-acquired MRSA or HA-MRSA, it's the hospitalization, surgery, long-term care, indwelling devices or history of MRSA. Moving to the objective, the main aim of the present study was to determine the methicillin-sensitive Staphylococcus aureus and methicillin-resistant Staphylococcus aureus and the antibiotic susceptibility pattern of these isolates. Materials and methods, a total of 60 Staphylococcus aureus isolates were obtained from the Department of Microbiology, Columbus South Teaching Hospital from 1st of January to 1st of April 2017. The identification of MRSA, all the isolates classified as methicillin-sensitive Staphylococcus aureus or MSSA were susceptible to cefoxitin with a zone of inhibition diameter of more than or equal to 22 millimeter. Whereas the isolates classified as MRSA, they were resistant to cefoxitin and the zone of inhibition diameter was less or equal to 21 millimeter. This was as per the CLS